Hi, Mr. Jones. Today, let's talk about your blood pressure, which is not being managed very well. You have what we call primary hypertension. It is the most common form of high blood pressure. It develops over several years and has no specific or underlying cause, although a family history of hypertension increases your risk. Being an African American male places you at a higher risk as well. Also, you don't pay attention to your diet, and so you probably eat more salt than is good for you, and this also contributes to developing high blood pressure. There are two other types of blood pressure. One is called secondary hypertension. This one is caused by an underlying health problem like kidney disease, thyroid disease, or pregnancy. Some medications can also cause secondary hypertension, and illegal drugs like cocaine can also cause this. This type of blood pressure problem appears suddenly, and it usually makes your blood pressure higher than primary hypertension would. Correcting the underlying problem usually resolves blood pressure issues with this type of hypertension. The third type of hypertension is called complicated hypertension or malignant hypertension. Now, while this one is rare, it is a medical emergency. This is an extremely high blood pressure, like greater than 180 over 120. It happens quickly and it causes damage to organs. Most frequently, it damages the kidneys or the eyes. Now, this can happen by missing a dose of blood pressure medication. Some underlying medical conditions like spinal cord damage can cause this. Tumors can cause this. Birth control pills and, of course, using cocaine can cause this. Now, high blood pressure has many effects on health. You have many risks in your life for high blood pressure and bad outcomes. You're getting older, and advancing age increases your risks with hypertension. As we get older, our blood vessels lose their elasticity, and having high blood pressure just makes it worse. The high blood pressure eventually damages the cells that line our arteries, and then the fat from our diet can collect there at the damaged sites, causing narrowing and blockage. This constant elevated pressure through the damaged and weakened arteries can also cause sections of the arteries to bulge out and form a pocket called an aneurysm. These weakened areas then are at risk for rupturing, and a ruptured aneurysm causes stroke, internal bleeding, and death. Damaged arteries also do not effectively transport blood and oxygen, and this also leads to organ damage, heart damage, kidneys, eyes, brain damage. Your weight. You have gained weight significantly over the past year. Being overweight and not routinely physically active causes your heart rate to be higher, which also increases the workload on your heart. That, along with the other damage that high blood pressure causes on the heart, sets you up for an enlarged heart, heart attack, heart failure. Your diet, we talked about briefly. The salt, eating too much salt causes your body to retain fluid, which increases your blood pressure. You also drink many drinks every night, possibly because you work in a very high stress situation. Being a police officer in a low income, low socioeconomic area, I'm sure is very stressful. However, drinking more than 2 or 3 drinks in a sitting would make you be considered a heavy drinker. And heavy drinking is linked to increased blood pressure. We talked about the stressful job. Stress definitely is linked to increasing blood pressure. You did make a positive change when you quit smoking. This is true, but much more needs to be done. Specifically, I'm going to talk a little bit about damage to your kidneys from high blood pressure. Now, the high blood pressure damages the tiny little blood vessels in the kidneys that filter out the body's waste. This damage makes the kidneys not able to function well and causes all that waste that they can't filter out to build up. And this buildup damages the kidneys. This damage occurs slowly over many years, and you may not have any symptoms for quite a while. But once the damage happens, the kidneys usually can't recover. And if your kidneys are damaged badly enough, they fail, and the only options for treatment then are dialysis or kidney transplant. To prevent this or any other complications from high blood pressure, your blood pressure needs to be well managed. First and foremost, you should be taking an appropriate medication or combination medication. You need to pay attention to your diet, specifically your salt intake. And not just the salt you put on your food. You need to be aware of the salt that is already in the food as well. It's recommended that you eat less than 2,300 milligrams of salt per day. So you need to not put salt on your food, and also check labels on your food. You definitely should reduce the amount of beer you're drinking every night, and you should start exercising regularly. Exercising and losing weight can go a long way towards lowering your blood pressure. You need to be checking your blood pressure at home regularly and keeping a record of it so that you are aware of how management is going and how well it's being controlled or not controlled. I know that with your job, saying to reduce stress is challenging, easier said than done. But you might try some yoga or meditation at home in the evenings. Exercising regularly will also help you reduce stress. These are some things that we need to work on, and I think that we can get your blood pressure managed.